By the end of this lesson, you should be able to identify what verbal communication and nonverbal communication is and how we use them in healthcare. So why are first impressions so important? Well, the opinions that we form in the early moments of meeting someone remain in our thoughts long after the words that have been spoken do. Therefore, you want to make a good first impression on every patient you come in contact with. So always address your patients by name. And you may not be sure what to call them, so ask them what they would like to be called. And then make a notation on the chart so that everybody can follow through by calling them what they want to be called. Smile and be positive. You've got no clue what kind of day they are having, and a smile can go a really long way to helping the process. Show compassion. Be aware of the personal lives of your patients. Get to know them a little bit. Questions such as, how are your children? When someone comes in, can really show them that you care enough about them to ask. Now, there are two forms of communication, nonverbal and verbal. Verbal involves words, and nonverbal is all the ways we communicate without using words. So first, let's take a look at nonverbal communication. One of the first things your patients will notice about you is your body language. So what's involved in body language? Well, it involves things such as eye contact, facial expressions, hand gestures, your grooming, how you're dressed, the space you're giving between you and the other person, the tone of your voice, your posture, your touch, so much more. So a couple of the highlights. Appearance, is an integral part of nonverbal communication. Our appearance influences the way others view us. And if our appearance does not match the message we want to communicate, it can present a conflicting message or even a totally incorrect message. So make sure your appearance reflects the message you're trying to give. Facial expressions often convey our true feelings and are not masked by the words that we use. Our eyes often tell the truth when our words are misleading or false. So your verbal and your nonverbal communication must be congruent. In other words, they must align. They must match. So take a look at this picture. What does this person's body language tell you? Take some time to review Table 2.3 in your textbook to view positive and negative nonverbal behaviors. The way in which we speak also influences the messages we send. So are you speaking fast? Is your voice clear? Are you speaking at a normal volume? Are you pausing at the end of your statements? Is your vocabulary and grammar appropriate for the situation? These factors can also inform us as to what's going on with our clients. For example, if your patient is speaking fast with a high-pitched voice, what could this mean? Well, for one thing, it could indicate that they are nervous or anxious about something. And that might be something you want to explore a little further. Refer to Table 2.4 in your textbook for more information on how these delivery factors influence how we interpret message. Now, the verbal communication consists of written and spoken messages. So written communication involves things such as messages, letters, emails, notes on charts, and online information. It's important that we consider how we state our written messages. For example, have you ever received a text message and thought that the person who sent it was angry with you, and then you replied back with an angry text, only to find out later that they really weren't angry with you to begin with? You misinterpreted the text? Well, so that's an example of a text message or a written message that was not stated well. So you want your written communication to be clear and factual. Also, make sure you check your grammar and your spelling before sending any form of written communication. Now, oral communication means when we talk with others. A big part of oral communication is listening. Have you ever spoken to someone and they heard what you said, but they really weren't listening? In other words, the ears were working, but it wasn't processing. And later, they don't even recall you talking with them about the subject. Well, this is because they were not actively listening. Active listening means that you're focusing completely on the conversation and you are processing what the person is saying. When we are actively listening, we can use questions to clarify the patient's statement and get more information from them as we need it. There's two types of questions that we ask: closed questions and open-ended questions. Closed questions are those that a person can answer with 1 or 2 words. You use these questions when all you need is factual information. For example, what is the name of your insurance company? What's your date of birth? Do you like ice cream? They're all closed questions. Open-ended questions require the patient to provide an explanation. For example, you stated you were not feeling well. Tell me more about how you have been feeling. This would then lead to the person giving you an explanation more than just a 1 or 2 word answer. We use open-ended questions when we want to dive deeper into a topic. Communication is the exchange of information. It occurs both verbally and non-verbally. We often gain more information from a person through their non-verbal behaviors than we do through their words. As a professional, you want to watch both you and your patient's verbal and non-verbal communication to get the full picture.